Our first speaker is Michael Gurven from UC Santa Barbara, who's going to talk about the costs of reproduction in a high fertility and mortality population.
Thanks again to the organizers for making all this happen. Okay, so a fundamental life history trade-off is that between reproduction, allocations of reproduction, and allocations to maintenance and survival. And in humans, this has been investigated mostly through kind of historical demographic analyses, and it's been a prominent kind of topic that has seen some evidence for the notion that survival is somewhat sacrificed at the expense of reproduction. Now, that idea of a negative trade-off between survival and reproduction is sort of countered by the notion of phenotypic correlation, something that's been around for quite some time. So even in this paper by Mary Beaton in the Proceedings of the Royal Society back in 1900, you see highlighted here, of two women who both lived beyond 50 years, the longer lived is likely to have had before 50 the larger family. In other words, some women can afford both larger family size and longer survival. So I think Gillian Pepper really highlighted the notion of disposable soma to bring evolutionary theory to bear on this notion of a potential trade-off, that selection might prioritize reproducing over perhaps, say, living a long life, and so that energetic and metabolic cost of reproduction, they might come at the cost, lead to a deterioration in material condition, which can affect the likelihood of disease and ultimately mortality. And so a simple prediction is just that you would expect an inverse trade-off between allocations of energy and resources to reproduction and that between what is required to maintain the soma and live longer life. And there's certainly some evidence for this, experimental as well as observational, but in model organisms such as Drosophila and works of Linda Partridge and others. But again, bringing up this notion that phenotypic correlations might produce spurious kind of positive relationships between fertility and lifespan. And so something that needs to take into account if you want to observe the trade-offs. Now, a related, not looking specifically at survival, but at kind of one upstream aspect of survival, nutritional status, there's a kind of literature on maternal depletion syndrome, this idea that high fertility, often measured just number of children that women have, women pay the price in terms of depleted nutritional stores, often measured by some type of anthropometric. And the evidence for this is somewhat in the direction of not much evidence for maternal depletion syndrome. Was first observed like in the 60s, especially in Papua New Guinea, where there's some evidence that higher parity is associated cross-sectionally with depleted nutritional status, but there's plenty of evidence showing no relationship or the positive relationship I mentioned before. So here, to kind of guide us, I want to try to use some longitudinal data and a nice set of controls and covariates that kind of helps us correct some of the problems with prior studies, so we can ask to what extent do repeated bouts of reproduction affect health status. And we're going to look similarly, given the tradition, nutritional status, looking at some anthropometric measures, but then we'll also go a little bit beyond that and look at some biomarkers of anemia, inflammation, and immune activation, to ask the question, is there evidence that greater reproductive effort might exert some cost on maternal soma? And the two measures we'll look here, we'll look at parity, like in some of those older studies, but we'll also look at the pace of fertility. And here I'm going to just operationalize it as the inverse of the average birth interval for women. And so I'm going to introduce here, because there's like I think 5 or so additional talks that all use data from this population. So I should borrow a minute from each of your talks so I can describe them now. Just the Tsimane, they're an Amazonian population in lowland Bolivia. There's about 15,000 Tsimane scattered in over 90 villages. It's a natural fertility population. It's very slash and burn horticulture is a main component of subsistence activities in the diet, so plantains, rice, as well as fishing, hunting, and fruit gathering. Fairly high infectious burden. And we've been studying, along with Hilly Kaplan and colleagues at New Mexico, but also in Santa Barbara and other places now, we've been studying them for over a decade. And one reason why we might expect the trade-off of all places in a natural fertility population like the Tsimane, first of all, Tsimane fertility is very high. The average woman, if she survives over her reproductive lifespan, can have 9 births with fairly short birth spacing, so and intensive breastfeeding on demand. So the average woman will have her first child at age 18, her last one at about age 37, and about 2.5 years between births. The infectious burden is fairly high, hygiene is poor, and there's energy limitations. There's high levels of stunting and fairly heavy work effort, and especially during certain seasons of the year. And so in addition to that, just anecdotally and through some systematic study now, there's just clear health differences between men and women. Some of this is published, some of this not, but compared to men, Tsimane women have lower self-reported subjective health. They have worse different physical measures, balance, coordination, walking endurance, greater problems with their joints, lower heel bone mineral density, fewer teeth, greater number of cavities, worse kidney functioning, greater risk of obesity and hypertension. Now, the overall rates are low, but nonetheless, compared to men, the rates are higher in women. Higher levels of inflammation, higher levels of infectious morbidity, and more depressed affect. So here I'm going to just show you, so using over a decade's worth of data, these kind of ugly, colorful spaghetti monster plots that just show these trajectories. And one thing, we can kind of group these trajectories into sort of decreasing somatic status versus increasing or somewhat fluctuating. And one thing, before even doing any fancy analysis, less than 8% of women are showing kind of steady decline in, say, weight, whereas about a third are showing increases in nutritional status over age, and then the rest, 2/3, are basically kind of fluctuating within a fairly narrow range over about a decade of life. And that's the same pattern if we looked, instead of weight, we looked at body fat, or if we looked at BMI, and going with respect to some biomarkers, whether we look at hemoglobin, sedimentation rate, a non-specific measure of inflammation, or a white blood cell count, a measure of immune activation, just throwing some, if you're interested in the clinical cutoffs, that women across the board seem to have high levels of morbidity with respect to these measures. It's not quite clear whether parity or pace of reproduction matters here. So to kind of just quickly throw, doing some mixed effects models where you account for the fact that you've got women repeated over time, we can control for a bunch of covariates that you would be interested in, but the things in yellow are the important variables of interest here. The parity of the woman at the time of measurement, the pace of fertility, and then an interaction between the two. And if you don't want to actually look at the numbers, those are all significant for women aged 15 to 44. We can just look at what it looks like visually. And so across the board, by parity, women, as for all the anthropometric measures, show evidence of decreased somatic status with respect to those variables. But the part that's interesting here is the highest risk is not with the women with the shortest interbirth interval. So I don't know if you can see, but the blue here is actually the women with the shortest interbirth interval. So those women actually show the least steep kind of curves, which is consistent with some phenotypic correlation that those women are somehow buffered. Now, if you take into account, though, that the full model, that because parity, this is all controlling for everything else, but certainly parity and age are not really independent. And so when age is sort of compensating for the effects of parity and pace, so over time, on average, women are actually having improved nutritional status. So I'm going to skip the results. There's nothing really with women over the age of 45 who've completed their reproduction. So whatever costs are writ large during the periods of reproduction, they're compensated, and there's no effect later on in life. Now, the biomarkers of inflammation, immune activation, and anemia, there's really not that much activity that we're finding. In fact, the only result in the same kinds of mixed effects models that control for a whole bunch of things is really women over the age of 45 with respect to higher levels of inflammation as measured by sedimentation rate. So if anything, that might be a postnatal effect of children, not actually due to pregnancy and lactation, because we don't see that effect during their reproductive years. I'll kind of move forward here. I got 2 minutes. So towards the end here, why repeated bouts of pregnancy and lactation showing some effects consistent with some depletion, but yet with age, there's a sort of net neutral or potentially even positive increase in nutritional status? Well, first of all, if we take a step back, one could argue that the short interbirth intervals and the high fertility is actually evidence that Tsimane women are actually in fairly good condition rather than really poor condition. We know from the Tsimane, but also similar populations, that with higher dependency, the work effort is actually lower, compensation by the labor of other individuals. Food sharing and support networks during pregnancy, lactation, in extended household clusters helps women subsidize the cost of reproduction, such as children also helping at the nest. And that one possibility that we're exploring is that women might maintain the soma but reduce investments in later born offspring. So where you might actually see evidence of the trade-off is in different characteristics of the children, not of the women themselves. So lastly, just to kind of summarize and conclude, the prior evidence of cost of reproduction in humans that was somewhat inconclusive, even with better data, longitudinal, is showing somewhat similar localized effects that get kind of erased over time if women survive, and that at equilibrium you might expect little evidence of net cost because women are probably adjusting reproduction, especially the timing of reproduction, to their condition and to the resource availability. But that as a species, reproduction in humans is relatively cheap given the resource transfers and subsidies and alterations in work effort that women seem to bear, that allows us to bear more kids per unit time, yet suffer relatively few sustained costs during those reproductive years and even into the post-reproductive years. All right, thank you very much.